Good afternoon. Thank you all for joining us this afternoon for our webinar. The title of this webinar is Mobile and Socially Connected, Engagement Fostered by Transportation Access. Next slide. Before we begin and do some introductions, I want to just provide an overview of how our webinar operates. So first, we encourage you to use either your computer speakers or dial into the conference call number. And please note that all participants are muted, so you will not be able to speak during the webinar. We have a question box feature where you can submit questions throughout the entire webinar. We will be monitoring those questions throughout the entire hour. And at the end, when the presenters are done, we will open up and read the questions to the speakers and give them a chance to respond to you and address your questions. Given that we are in a time of increased telework and a lot of people are using telework platforms, we may experience some technical difficulties. Rest assured that we are monitoring all of the sessions and the pieces going on with this webinar, and if there are any technical errors, we are looking to correct them in the background. So we apologize if that happens, but again, rest assured that we will be working to make sure that you are still able to hear and see the content we're presenting today. Next slide. So the webinar is being hosted by the engAGE National Resource Center for Engaging Older Adults. Our center promotes and provides opportunities to improve rates of social engagement among older adults. We support the Aging Network with information about emerging trends, resources, and also share opportunities for replication of different strategies that can be used in different communities. We aim to educate and inform about leading and innovative engagement approaches and practices and programs. And lastly, we collaborate with a wide range of diverse organizations to not only develop and promote engagement opportunities, but to do this in a wide variety of different channels and methods. Next slide. So today we have two wonderful presenters that will be sharing some exciting programs with us. The first presenter is Brianna Smith. She's a general manager with Luz Go and Red Apple Transit, and she's coming to us from Farmington, New Mexico. And Peg McDonough is a planner with the Berkshire Regional Planning Commission. She works on the age-friendly Berkshires, and she's coming to us from Pittsfield, Massachusetts. Next slide. I also want to, before we move forward, introduce Virginia. She's Director of the Transportation at N4A and the Co-Director of the National Aging and Disability Transportation Center. And she's going to provide a framework for our context given the current COVID-19 situation.
Okay, thank you, Karan. Lori, would you move to the next slide, which has the NADTC logo on it? Thank you. So as Karan mentioned, I co-direct the National Aging and Disability Transportation Center, which is a partnership of N4A, Easter Seals, and we're funded by the Federal Transit Administration. So our focus is on ensuring that older adults and people with disabilities around the country receive rides when they need it, that they have access to transportation information as well as transportation services that they need. And to do that work, we work very closely with communities, with area agencies on aging, with public transit agencies, with centers for independent living, whatever those organizations are. And I did want to take the opportunity to first of all, thank Karan for this opportunity to partner with the engAGE Center because we see that there is a very intimate connection between transportation and the ability to access services and pleasurable opportunities in the community. And the need to address social isolation, particularly as it affects older adults and people with disabilities. So we're really appreciative of this opportunity. We are in partnership with the engAGE Center, in addition to this webinar, which we helped plan, we're also going to be doing a special issue of the engAGEd e-newsletter, and we're putting together a blog as well. And I just wanted to say just a couple of quick words about what we've learned about the impact of the coronavirus on transportation in just the last few days. First of all, the Federal Transit Administration, which funds public transit around the country, has issued a lot of directives and advice to public transit agencies about sanitizing their vehicles and addressing issues related to rider as well as driver safety. We've been talking with a number of different kinds of programs, however, and we found that in talking with some of the volunteer programs and some of the smaller public transportation programs, that many of them are experiencing a reduced demand for rides, and they're also prioritizing the kinds of rides that they are providing, particularly to get people to medical appointments and to grocery stores. They are also instituting policies to sanitize vehicles, including advising volunteer drivers who use their own vehicles to transport people, that they are given advice and guidance on how to keep their vehicles clean, both before offering a ride and after offering the ride. They're also in one program that we've talked with, NV Rides, which is in Northern Virginia. One of the things that they're thinking of instituting really shortly is to recruit more younger volunteer drivers. Many volunteer driver programs depend heavily on volunteers who are age 65 and older. And as we know, this is a group of people who need to stay at home very often, especially if they have medical conditions that would put them at higher risk of contracting the virus. And so some of them are facing reduced numbers of volunteers who are available, and the importance of having some younger drivers on hand. And finally, in addition to the transportation services that these programs provide, they're also connecting with other community services. So that groceries, in some cases, or boxes from the food pantry are delivered to people's homes, as well as making friendly calls to people who are regular riders of their system. So with that, I'm going to turn it over to Peg. So Peg, thank you very much for you and Brianna for sharing your expertise with us this afternoon.
Thank you, Virginia. Can everyone hear me okay? My name is Peg McDonough, and I am a planner at Berkshire Regional Planning Commission. And while we are not transportation providers, we provide technical and planning assistance to providers, and we are also the convener of the Metropolitan Planning Organization and convene all the transportation activities relative to federal and state dollars that go to our county for the provision of transportation. Next slide, please. We're working on a little project called Every Ride Counts with a mini grant provided us by the Berkshire-Taconic Community Foundation, which will enable us to reach out to 6 underserved communities on the fringes of Berkshire County. That is 6 of the 32 municipalities that we have here. Next slide. We had just gotten the funding, and for those of you who don't know, Berkshire County is in the furthest westernmost part of Massachusetts. We are a mountainous community, mountainous in the East Coast mountain height, 2,000 to 3,000 feet. But we are a rural community, and since Massachusetts ranks 43rd out of 50 for the provision of transportation. The dollars that are normally sent us are kind of what's left over from the greater Boston area where all the population is. Next slide. So to get back to Every Ride Counts, we had a proposal, a mini grant to focus on rural transportation in 6 communities. And here's a snapshot of our demographics. 128,000 people, 931 square miles. Next slide. We are really a retirement destination. We excel at the arts, culture, and we are also a post-industrial town, so we have a lot of mill buildings that have been converted to not only business incubators, but for small business development, but also, again, part of the arts and culture scene. It is a beautiful community. We have a lot of retirees. We're at least 50% over the age of 50 and growing. We are the 2nd oldest county in the state of Massachusetts. Next slide. As I mentioned, our BRPC is the regional planning entity for our county, and we work with all of our communities to further their goals through planning, economic development, transportation planning particularly. Next slide. I have the enviable job of being the convener for the Age-Friendly Berkshires program, which is a coalition movement dedicated to making the county more livable for people who wish to age in place. We're working on 8 areas of livability, but I can honestly say that transportation always comes up as number 1. Some of it is perception, but some of it is reality. And what we're doing now is kind of drilling down into each town's experience and trying to customize solutions for them. Next slide. The area of focus for Every Ride Counts are the counties on the right-hand side of the map, the white uncolored towns, Windsor, Peru, Hinsdale, Washington, Beckett, and Dalton. As you can see, the red on the map is the Regional Transportation Authority bus routes, but the rest of the communities have to rely on a kind of a hodgepodge of programming. And right now, since our need for older adult transportation and disability transportation has grown, we're trying to integrate them into kind of a larger network. Next slide, please. I can say, though, that with COVID-19, the plans for Every Ride Counts are changing. We wanted to use the awareness campaign developed by NADTC to focus community conversations on transportation needs. But all of my work has now shifted to really kind of emergency response to the needs of seniors who now have to shelter in place, possibly for long periods of time. The first COVID cases were diagnosed in Berkshire County, and we have now close to a dozen active cases with people in our regional hospital, and that number is growing. So while I'm explaining this program to you, bear in mind that my timeline will certainly be extended for this program. Next slide, please. Every Ride Counts. I think what COVID is going to help us do is to really focus people's attention on what are the day-to-day needs around getting a ride. We know, for example, that medical rides, of course, are a priority for everyone, and most people rely on family first, friends second, Council on Aging, transportation, third, but since in our 6 communities that we're focusing on, there's only one Council on Aging service provider in one community, we know we need some additional help. So first, we're going to distribute our existing 3-page transportation providers list, which, while it's been in existence for a number of years, has never really gotten out to the general public adequately in a format that is accessible. We are going to identify assets that towns probably have and maybe are not putting it into service adequately, like school buses and things that are inactive during certain parts of the day that might be pressed into service for older adults and those with disabilities. And we are going to do a quick survey town by town to see what are some of the specific needs and identify areas where towns can work together. Next slide. We will, of course, add any information that we collect to the regional database of information regarding providers and service needs. But I think we're also going to reach out very specifically to human service and paratransit providers who we know go to every community in our county, but in fact sometimes just cut through on their way to somewhere else and they don't stop. So we're trying to see if there needs to be legislative work around overcoming the barriers to, say, the veterans paratransit providers picking up additional seniors on their way to the same destination. And again, we're going to engage town leadership in helping us to develop a solution specifically for their people. But I'm interested to hear how the participants are being affected by COVID, especially around the fact that this may go on for months and that we have to now think completely differently about getting services to people rather than bringing all the older adults out into the community, basically just to protect their health. So thank you for this opportunity, and I look forward to speaking with all of you.
Okay, can everybody hear me? Okay, my name is Brianna Smith, and I'm with the Capacity Builders. We have come into the Northwest New Mexico Transportation Alliance. I'm going to tell you a little bit about what we have done and fighting the challenges in our area and what we're doing now to continue on this program. Next slide. Okay. So we are actually in Farmington, New Mexico. We're in the Four Corners, and we're actually surrounded by 4 different Indian reservations, with the largest being the Navajo Nation here, as you can see on this slide. Next slide. Okay. So our study is done on San Juan County within Farmington, New Mexico. San Juan County is roughly about 5,500 square miles, with taking into account that 63% of those miles are Indian reservations. The Navajo Nation does take up 60% of that. The average household income in San Juan County is $49,000, and we are at 22% poverty rate. We have a 38% poverty rate on the Navajo Nation, and we have 47% of the Navajo Nation is over the age of 40. So it just kind of goes to show, the population that we are working with is of age and does have people with disabilities on it. If you look over to the right side, you're kind of seeing the area that we're trying to help out in. From the reservation, from Farmington to Shiprock is 34 miles, being the closest. The furthest out that we go to is Nashidi, out on the reservation, and that is 70 miles. These are all one-way totals. This is not round trip. Next slide, please. Okay, so challenges in our area for seniors and people with disabilities, what we've seen. The biggest one is always going to be reliable transportation. Currently, there is not a reliable transportation that can get you from the reservation onto the largest town, which would be Farmington, New Mexico. The distance for caregivers to drive out to see family or elders often is a huge problem. And then we always roll back into ADA compliance on the reservation. We do not have ramps out there. We don't have paved roads on the reservation, and we don't have any NEMT services allowed to drive on reservation roads, so they cannot go onto the sovereign nation. The distance between neighbors to check in on each other it's too far between, so you don't have a lot of social interaction on that area. One of the biggest ones is we are a part of a food desert area. Most locations, like we just saw, is anywhere between 35 to 70 miles away one way. And then right now we are dealing with a lot of closures of non-essential companies on and around the Navajo Nation since the first confirmed case of COVID-19 on the Navajo Nation. So we are definitely dealing with ourselves COVID outbreaks, I guess if you want to say, around our area. And this is definitely impacting our elders from being able to get out. And just to mimic what Peg said a minute ago, we need to focus now on how to get items to them instead of them getting into town. This is definitely a group of people that should shelter in place and not come out, and that's what we're working on currently right now. Next slide. Okay, so part of our transportation, we had transportation opportunities given to us, to the elderly and disabled community through an awarded grant by the NADTC in 2019. For our project accomplishments, in roughly about 5 months, we transported 1,295 participants, roughly about 257 participants per month. This was anyone in San Juan County that was age 60 plus, or anyone that did have a disability could take our shuttle for free, low cost or free, into town to get necessities, not just medical transportation to doctor's appointments. This was made to help them get out, become out of social isolation, be around peers, and do things other than just doctor's appointments. Next slide, please. So our project accomplishments on what we wanted to achieve and what we did achieve. We wanted to provide curb-to-curb paratransit transportation services to everyone in the Navajo Nation and around San Juan County for any older adults and individuals with disabilities. We wanted to provide transportation services to be provided to this target population at low cost to no cost, which we do succeed in doing. And we wanted to reduce social isolation in seniors and disabled individuals by providing assistance in getting around. Number one thing that we always heard was transportation. I can't get there. I can't go there. And that was a huge part of that social isolation. Helping individuals get to and from local food pantries in Farmington from anywhere in San Juan County. This was a huge one on our plate because along with social isolation, being on the reservation or outside of town without any transportation to come in, we ran into a lot of elders and seniors who were living off of food boxes made for 1 week and making them last for 1 month. This is something that we are currently trying with everything now with the COVID. We are getting in contact with our local food banks and chapter houses who have food boxes to get out to the elders and seniors and people with disabilities so that way we can help during this COVID ordeal and get it out there so that they can continue to eat. They can't come into town right now, so we're looking into helping them go and deliver food, sort of a Meals on Wheels, but we're looking to help anybody that needs help right now that has sheltered in place. The elderly and disabled are number one priority right now. Next slide, please. Okay. And these are some pictures that we have taken from our project for the NADTC project in 2019, different demographics that we helped just get out there and show, next slide, show them that there are places that they can go to, socialization with individuals, ADA compliant, being able to get them in a wheelchair. getting them in their motorized scooters, walkers, whatever, letting them know that there is a choice to get out, and we were willing to help them. Next slide, please. Just another photo of everybody. We took them to a lot of fairs on our in our grant time. We took them to chapter houses to eat lunch. We went lunch, breakfast, and dinner at certain chapter houses to be able to help out the elderly getting out there. We also took them to our local food bank, which we became a major sponsor in, to be able to transport individuals to get those food boxes again. Next slide. Okay, so what are we doing now? Mind you, this was kind of wrote a little bit before what we're dealing with across the country right now. But we are doing a spring and summer blitz for 2020 of Every Ride Counts campaign. And that is, Every Ride Counts is an NADTC comprehensive publicity campaign to promote the ability and accessibility of transportation options for older adults and people with disabilities. So we are definitely pushing that. I've put some photos there on how we've done that. You can see on our shuttle that we use for the elderly and disabled that we've got wraps on the buses looking out every single day. This has been a really good portion of getting the word out there, so to say, because you see our buses daily on the road. And this campaign has tremendously brought volume of calls into the office about our services for elderly and disabled. And we're able to talk to more caregivers and individuals who want to get out more. And so this has been a huge help, and we're already seeing numbers increasing in ridership. We wanted to increase our access to healthcare and improving health outcomes by providing the affordable transportation. So by doing this, we are helping them get out of social isolation, which is proven to have, assist with lowering the risk of health problems such as depression, dementia, stroke, premature death. I mean, those are things that are proven for people, individuals that are in social isolation, that they deal with health risks like these. We also started a volunteer driver program so that they can help us drive our community van around. And basically what they do is they come in, we set that up. They are, like Peg kind of said, is we do have senior drivers. It's the drivers of your peers that are still able to drive, that a lot of these guys want to still help out within their community. And what we've done is, we check DMV records, we do driver's license checks, insurance verification, background checks, and then we walk them through an orientation and training program so that they can know how to do our ADA compliance vehicles. This volunteer driver program right now, as it stands within the state of New Mexico, we did have to put it on hold just to deal with the COVID outbreak and try and not have so many people on the buses. Capacity Builders does run the city transit as well, so I do run Red Apple Transit, which is our city transit. And what we have started doing is social distancing policies here in Farmington. And what that means is a bus that normally would have carried 30 passengers is now only carrying 15. We are having to cut down so that way we have somebody on the left side window seat, next patron is the right side window seat. So we're kind of spreading them out by that 6-foot distancing. And what that's done for our shuttle program right now, it is still running, but however, we have gone from a 15 capacity shuttle to a 5 capacity shuttle so that we can get 4 individuals on the bus and 1 ADA compliant motorized vehicle, scooter, whatnot onto the bus as well. So it's definitely showing an impact. Ride services right now, like I said, have definitely decreased due to this outbreak, but we are dealing with it as it comes. And next slide. And just in case anybody would like to see on how we've been promoting our volunteer driver program, this is it. We printed out a bunch of flyers and we try to get these out about 100 flyers a month. We have a lot of riders actually ask for these so that way they can pass them around senior community centers, everywhere that they go. I've had many of people who are riders that hand them out at Walmart to other elders that they see. just so they know that there is help out there. And if they know anybody that wants to come and volunteer and help drive the bus, that they hand these out for us. So it's been really beneficial. And next slide, please. Okay. Sustainability and funding for our program. We were an awardee of the Access and Mobility Partnership Grant. We were awarded $130,000 for the next 2 years, and that's going to help us increase access to care, improving health outcomes by doing so, and reducing the healthcare costs. So basically getting people where they need to go in both healthcare, allowing the transportation aspect to be a big factor so there is no more reasoning on why they can't go. We will provide that transportation. We've also applied for the New Mexico Developmental Disability Medicaid Waiver Program. We are still on the list, unfortunately. The time list for this to be awarded is up to 24 months. We are currently sitting at almost a year right now, so we are still waiting for those. If we do get it, though, we're going to be able to provide free rides for recipients in the Medicaid program. We have also applied for 5310 and 5311 funding for the fiscal year 2021-22. Application was submitted in September 2019, so we are crossing our fingers here that we do get that. It will definitely allow us to have more vehicles and provide more services for everyone in the county. If you think about it, for San Juan County, we did 1,300 rides in 5 months for elderly and disabled. Imagine if we had the money and funding that we could do even more. So we are definitely keeping our eyes open for that one. And next slide.
Well, I'm going to thank both of our presenters for sharing all of the great resources and activities that are happening, and even really framing it and highlighting a lot of the activity that's still happening given the COVID-19 situation. But again, thank you both. So at this point, we're open for questions for our presenters. I do have one question, but again, if you have questions for either of our presenters or any of our staff here at N4A, please feel free to ask. So the first question, and I think it's going to apply to both you, Peg and Brianna, is what have you noticed about paratransit and other public transportation option changes in service due to COVID-19?
Well, I can answer for, sorry.
No,
I can answer
okay.
for
Go
Red
ahead.
Apple Transit. Red Apple Transit, like I said, is we are definitely seeing decreased ridership. What we're doing right now is obviously we are sanitizing the buses after each run. So every 1 hour circle loop, we're having everybody get off the bus. We are cleaning with a bleach solution. We have asked that we have masks on staff. We have hand sanitizer, and we have wipes on every vehicle that we are wiping down on the hour before the next loop starts. We're using the social distancing policy, like I said earlier, but unfortunately, a lot of our elders and seniors are still not able to ride the bus because of health concerns. So we're definitely seeing a decrease in ridership for sure.
The same with us in Berkshire County. We're definitely seeing the drop in ridership. All of our providers have instituted their own, sanitary procedures for disinfecting their vehicles. But it is kind of early yet, and we're concerned about the people who are perhaps not taking this seriously enough. But we're afraid that if it goes on for longer, some of these very critical needs will be able to be addressed in other ways. Right now, I think everybody's kind of trying to figure out how to do it.
Okay, thank you both for your responses. I don't see any more questions in the chat. Again, if you have a question, we'll give it another minute or so for anyone to ask any questions. In that, do any of our presenters, Virginia, Peg, Brianna, want to share any final thoughts or any closing comments? No pressure, just if you have any. With that, I'm going to then thank everyone for attending today. Again, we hope that you found this information helpful, and given, again, the context of COVID-19, thinking how your programs can continue to run, or thinking about some things that are considerations for your transportation programs or programs in your community as well. This webinar will be posted to the engAGE website under our archive of broadcasted webinars. And again, we thank you for your time.
Thank you. Thanks, everybody.
Thank you.